It is imperative that relatives of all patients in the country's hospitals are left feeling that the patients are in good hands. Now, these were the words of the Prime Minister at the opening of the Prime Minister's Interministerial Consultation with the Swaziland Nursing Council, the Swaziland Higher Education Council, government and hospital managers, and matrons, as well as representatives of allied professions at the Cabinet offices. We report.
His Majesty's government, led by the Prime Minister Dr. Barnabas Sibusiso Dlamini, continued with her drive to reform the health sector in the kingdom. On Monday, the Prime Minister's interministerial team held a consultation meeting with the Swaziland Nursing Council, Swaziland Higher Education Council, Swaziland Nursing Association, government hospital managers and matrons, and representatives of allied professions. The Prime Minister said the consultation is a continuation of the process that commenced, in which task teams were created to examine selected areas of the National Health Services in order to resolve operational problems that affected negatively the quality of service delivery to Swazis.
During our consultation on 26 June, I indicated that to complete Cabinet's exercise on healthcare, it might be necessary to appoint another task team to investigate nursing services and patient care. We have indeed decided to hold a consultation here today to discuss the issue of nursing services and patient care, in which standards are understood to have fallen in some of our medical centers in recent times. We have, for example, received reports of individuals sleeping under the hospital beds of sick relatives owing to lack of confidence in the quality of nursing care, patient care by nursing staff. While we understand this to be only a recent phenomenon, it cannot be allowed to continue. It does not happen in the private sector hospitals and clinics and in our ICUs. Perhaps where there is a patient who is seriously ill.
The Prime Minister said the issue of training of nurses should also be discussed, and for instance, whether includes too much theory and insufficient practical work.
On the subject of training, let us also include discussions of enabling legislation. The 1965 Nurses and Midwives Act, as amended, gives authority to the Swaziland Nursing Council on matters relating to training programs for nurses and the relevant training institutions. It has, however, been brought to my attention that the Swaziland Higher Education Council of 2013 gives authority to that council in respect of the same issues. My understanding is that later legislation should supersede an earlier statute where there is a duplication of this nature. This matter should be clarified within the Nursing Council and the Higher Education Council.
The Prime Minister added that a further task team will be appointed by Cabinet and that the views from the consultation meeting will be submitted to the new task team. Reporting for Swazi TV News, I'm Sibusiso Dlamini in Mbabane.